Okay, let's have a quick pathology review. The genetic locus for MHC is on chromosome 6, H2 in mice. NK cells release perforin and granzyme. In the class 1 MHC pathway, peptides are produced from proteins in the cytosol and are transported to the endoplasmic reticulum, where they bind to class 1 MHC molecules. The peptide MHC complexes are transported to the cell surface and displayed for recognition by CD8 cells. In the class 2 MHC pathway, proteins are ingested into the vesicles and degraded into peptides which bind to class 2 MHC molecules being transported into the same vesicles. The class 2 peptide complexes are expressed on the cell surface and recognized by CD4 T cells. In type 2 hypersensitivities, antibodies attach to cell surfaces. Type 2 hypersensitivities involve opsonization, phagocytosis, lysis, but what precedes lysis? Complement, activation cascade of C1q, C1r, C1s, C2, C3 is the main one, C4 and C5. What type 2 hypersensitivity affects gastric parietal cells? Pernicious anemia. What type of hypersensitivity disease are autoimmune hemolytic anemia and idiopathic thrombocytic purpura? Type 2. What type of hypersensitivity diseases are SLE, lupus, and polyarteritis nodosa? Post-streptococcal glomerulonephritis, Arthur's reaction, and serum sickness. They are type 3 immune complex. SLE is a type 3 disease resulting from failure of self-tolerance. Susceptibility genes interfere with the maintenance of self-tolerance, and external triggers lead to persistence of nuclear antigens. In lupus nephritis, you can see wire loop lesions representing extensive subendothelial deposits of immune complexes. What type of degeneration would you see in SLE involving the skin? Liquefactive. And remember that immunofluorescence micrograph stain for IgG reveals deposits of IgG along the dermo-epidermal junction. Where is amyloid deposited? Excuse me, in the extracellular space. Where would you find amyloid at first? After the blood vessel walls, kidney, spleen, liver, heart. What type of amyloid is found in Alzheimer's? Alpha beta. The composition of amyloid is 1. A fibrillary protein, 2. Amyloid P component, 3. Glycosaminoglycans, and you would see what kind of stain? You would see this in what kind of stain? Congo red. So remember, it is a fibrillary protein, amyloid P component, and glycosaminoglycans. With an H&E stain, would you see amorphous eosinophilic deposits? Yes. Regarding the pathogenesis of amyloidosis and deposition of amyloid fibrils, what protein would result from chronic inflammation, macrophage activation, interleukins 1 and 6, and involve liver cells and SAA protein? That is AA protein. Regarding the pathogenesis of amyloidosis and deposition of amyloid fibrils, what protein would result from an unknown carcinogen, monoclonal lymphocyte proliferation, plasma cells, and immunoglobulin light chains? AL protein. Regarding the pathogenesis of amyloidosis and deposition of amyloid fibrils, what protein would result from normal amounts of normal protein, a mutation, a mutant transthyretin? That's ATTR protein. Name a disease involved in primary amyloidosis and what type of amyloid is involved. multiple myeloma, B-cell lymphomas, fibrillary protein, kappa or lambda light chains, amyloid light chains, AL. Name a disease involved in secondary amyloidosis and what type of amyloid is involved. Amyloid-associated AA, fibrillary protein, serum amyloid A, produced by liver with ongoing inflammation and neoplasia, RA-SLE, Crohn's disease, cancer, and TB. Describe familial Mediterranean fever. Well, to begin with, the type of amyloid you are dealing with is AA. Yep, AA. And the type of fibrillary protein is serum amyloid. Oh yeah, and don't forget that it is an autosomal recessive disease, and you would have a recurrent inflammation and fever. How about hemodialysis-associated amyloidosis? Can you describe this? It involves alpha beta 2M. The fibrillary protein is beta 2 microglobulin. There would also be carpal tunnel syndrome and joint disease. So there. Is it true that the types of system amyloid that may have poor prognosis include kidney, heart, liver, spleen, GI, and GI tract? Yes. Regarding a localized type of amyloid, what do you know about senile cerebral amyloidosis, or Alzheimer's disease, excuse me? It involves amyloid alpha beta, fibrillary protein, beta amyloid precursor protein, beta, APP, and you would have Alzheimer plaques in cerebral vessels. Describe senile cardiac amyloidosis. The amyloid involved is ATTR, amyloid transthyretin. The fibrillary protein is transthyretin, and there would be some heart failure. Describe yet another localized amyloid concerning endocrine diseases. Medullary carcinoma of the thyroid, procalcitonin, adult onset diabetes, amylin, and pancreatic islet cell tumors, or amylin.